emergency department. Up until about 6 months ago, I was able to say I had never seen an overdose from cannabis use. A lot of intentional overdoses, a lot of accidental overdoses, and I thought, I'm never going to see an overdose from marijuana, and I did. There was a mother, she had 2 boys with her, and her husband. She had recently had some surgery, and she, by some way, had access to some edibles in the form of a brownie. It was from another state that has legal marijuana. I'm not sure if it was a fully legalized state, but it was marked with a dosage. She was told when she was given this brownie to eat a fourth of it. Edibles, I can tell you, have a longer onset of their actions, and they last a lot longer than does smoking or vaporizing marijuana. So she, with her first bite, if you will, or 1/4 of this brownie, she didn't feel the effects because the onset is a lot longer. I just pulled this up because it's a good site that I might recommend to you. It's called consumerresponsibly.org, and it goes on to say, because of the way in which the body processes marijuana, ingesting it typically produces much stronger and longer lasting effects, whereas the effects of inhaling marijuana are immediate and peak within 10 to 15 minutes. Ingesting marijuana can take up to 2 hours to take effect and can peak for a couple hours after that. So after she ate the 1/4 of the brownie that she was instructed to only eat, she consumed the entire brownie. She did present to my emergency room with very decreased respirations and was monitored overnight in our intensive care unit because of that, and was discharged the next day without any other untoward effects. But it is a possibility. I think we should understand that the dosages are out there. Strengths and dosages are out there, and they should be followed. And we should have regulations concerning those. And that's my experience with overdoses on marijuana. Like I said, I've seen hundreds of intentional and accidental overdoses, one of marijuana, and she didn't follow the directions. Back to where I was, my personal experience is very simple. For 35 years, I've used cannabis for various reasons. I now have osteoarthritis that is progressively getting worse. I don't like the side effects of pain medicine. I've tried every form of therapy, NSAIDs, massage, stretching, strengthening, etc. to relieve the pain. No pain meds do the job without the horrible side effects. But a simple breath of cannabis, I immediately get relief and I have a much more productive day. From a professional perspective, I've noticed and I've been very perplexed with the stigma associated with smoking or vaporizing as a route of administration for dried, whole plant cannabis. My goal was to find literature supporting the notion that cannabis, even in long-term use, was not harmful as the government was telling us. It certainly hasn't had all the effects on me that are reported. Patients who choose to smoke or vaporize do so for various reasons. For example, smoking delivers instant relief, as I had mentioned. It's fairly easy to regulate the dosages. It's inexpensive in comparison to other forms, while vaporizing provides the same results with less harshness in comparison to combustion, fancy word for smoking, and has less smell. From a pulmonary professional standpoint, both provide bronchodilation. Evidence to that effect is found in a study by French researchers published in the British Journal of Pharmacology in December of 2015, explained herein by American physician Dr. Donald Tashkin. Dr. Tashkin was not involved in this particular study, but his interpretation of the findings led him to state, THC works before traditional asthma medications. Traditional bronchodilators keep a naturally occurring molecule called acetylcholine from binding to its receptors. THC, on the other hand, works proximal to traditional medicines and prevents acetylcholine from even being released, thereby relaxing smooth muscle and relieving bronchoconstriction that's associated with an asthma attack. This leads me to Dr. Donald Tashkin, who you first heard about from Dr. Susan Sisley. In the 70s, Dr. Tashkin conducted studies in his lab at UCLA done with funding from the National Institute on Drug Abuse, which supposedly produced irrefutable evidence of the damage that marijuana wreaks on the bronchial tissue. In fact, it is Dr. Tashkin's research that is most often cited in ads linking marijuana to lung cancer. Imagine the surprise of the International Cannabinoid Research Society when in 2005, Dr. Tashkin, while concluding an independent study in conjunction with the LA County Cancer Surveillance Program, stated, marijuana smoking, even heavy long-term use, does not cause cancer of the lung, upper airway, or esophagus. The ICRS went on to point out that one of Dr. Tashkin's studies showed a negative correlation in at least one category, indicating a protective effect. To which Dr. Tashkin stated, I think it would be difficult to extract that conclusion based on this particular data that the marijuana has a protective effect against lung cancer, but that is not an unreasonable hypothesis. When speaking of lung disease, I think it's always important to touch upon COPD, chronic obstructive pulmonary disease. Pulmonary functions tests are needed to determine whether you have COPD, which is a big umbrella term for a lot of lung diseases, asthma being one of them. Emphysema is an old word that's associated with COPD. This condition is typically diagnosed by using pulmonary functions tests, most notably an FEV1 and an FVC, and I won't bore you with those terms unless you have a question for me on that. And it's also been a huge concern for opponents, especially in young adults who choose to smoke marijuana at an early age and continue on, as myself. The Journal of American Medicine Association, better known as JAMA, very popular medical publication, in 2012 published results of the coronary artery risk development in young adults, the CARDIA study. This study was a longitudinal study collecting measurements of PFTs, pulmonary functions tests, associated with smoking marijuana over a 20-year period from March of 1985 to August of 2006. The study population consisted of over 500 males and females from 4 large cities and concluded analysis of the PFTs and lung disease have failed to detect clear adverse effects of marijuana use on lung functions. This information is a small part of the extensive research that has been done to prove not only the efficacy of smoking cannabis as a medicine, but also as its potential as a positive preventative medicine. I'd like to, again, go off script if I could and point out to you not only one patent that's held by the United States government, but here within the packet I gave you the current patents. There's 21 of them. Some of them are already, they've already obtained, some of them are pending, some of them they've just applied for. One of those does address COPD and the use of THC that we've spoke to many times here as the psychoactive component in cannabis, and seems to be the one part that holds the most stigma. The COPD patent is related to all inventions that may come in the future. I find it funny that all of these are in reference to things that may come in the future and are held by the U.S. government because they know there is medicinal benefits to it, to cannabis in many, many disease processes. Other thing that was in your packet that I gave you was this psyche inhaler, which is really new. I've looked into the unfortunately not been mentioned that much in these hearings, which I'm pretty surprised. It's called the Psyche inhaler, and it actually uses dried whole plant cannabis. You can see the cartridges here, and it has a filament in it that does heat the dried plant, so you are smoking it in a sense. It's not vaporizing it. I can explain vaporization to you if need be. So I kind of tossed that in the last minute because I was particularly interested as well. And I also tried to make some of your research a little easier for you. There's some very helpful websites, YouTubes, whatever, and I kind of tried to touch on each one of the task force members' disciplines that you represent. Most notably, a very important one that I found was the very first one, study by Dr. Maria Sanchez, a molecular biologist who studies cannabis and cancer. I also urge you to Google, if you've been on for, the entourage effect, which is amongst those of us who have been looking at this for years can tell you is the combination of THC and CBDs in use in medicinal forms and how one potentiates the other, and that it is essential in some instances to have THC and CBD mixed. The other one that I'd like to point out is the National Cannabis Chamber of Commerce. It's a very informative site. I suggest you might have to pay a little nominal fee to join for education and updates, as a lot of these sites do, but it isn't wordy.
I would suggest you don't join that one. It's a public official, like,
You get to look at it freely. Good. So with that, I'd like to conclude my testimony here, and I thank you, Chairman Sherman, and members of the task force for allowing me time to speak, and I'm now available for any questions you might have.
Thank you for your testimony. Any questions for Ms. Johnson? Thank you for your testimony and the information you provided to us.
Thank you.
We appreciate it. Our last